Before we delve into the main topic of today's webinar, I will start with a brief refresher of what we mean when we talk about assessment center and a development center, and what makes these methods different from other types of tools and methodologies. So compared to other methods, assessment centers are known to give a very broad and very accurate picture of a participant's competencies and potential. But in order to do that, they have to meet a number of fundamental quality requirements. And also remote assessment centers need to meet these requirements. So first of all, an assessment center is comprised of multiple exercises or components that are each designed to elicit a variety of job relevant behavior and information. Another fundamental aspect of an assessment center is the use of simulation exercises, where the participant is presented with a fictitious job-related situation and has to react as if that situation is real. For example, in a management role play or an oral presentation. And then the assessor can observe work-related behavior directly. And that is not possible in any other type of exercise, which is why simulation exercises, and preferable two of those exercises, should be included in an assessment center. That's why these types of exercises are such a fundamental aspect of an assessment center. Then, of course, the AC needs to be conducted by trained and certified assessors, and each participant needs to be observed by more than one assessor. It's also sometimes called the 4 eyes principle, and it ensures that one assessor's individual preferences won't have too much of an influence on the results. So now that we know what makes an assessment center, we also know what does not qualify as an assessment center. For example, an HR professional acting alone and conducting a situational interview, or even a small role play during a selection process, or a fully automated assessment that does not require any observation or evaluation of behavior. So while these procedures can certainly have their merit and they can, in some cases, yield very useful results, they won't allow for the broad and accurate picture that you would get if you would conduct a true assessment center, which is why they should not be labeled assessment centers. Then onto the remote assessment center. What is the main differences between a remote and a traditional on-site or brick and mortar assessment center? Well, first of all psychometric tests are administered through the internet and completed by the participants when they want to do that, and without any supervision or proctoring of the participant while they are completing the tests. And secondly, all participants' assessor interactions are conducted via video conferencing. So they only see one another on screen, and there is no face-to-face interaction between assessors and participants. So a very legitimate question that we then sometimes hear from clients is whether a remote assessment center is as valid a method of evaluating participants as a traditional in-person assessment center. Well, at Hudson, we can say that it is, as long as the fundamental assessment center quality requirements are met. A remote assessment center it has the same quality as a traditional assessment center. And we base this conclusion not only on our own experience, but also on a thorough review that we did of the scientific literature in the domain. So we always try to keep up with the latest scientific developments, which is why we looked up all scientific studies researching unproctored internet testing and video-mediated assessments and comparing those with the more traditional assessment center scenario. And we focused mainly on answering questions like whether the scores are comparable, whether the accuracy and the validity of the assessment is impacted, and also whether the candidate experience or the participant experience is the same in a remote assessment center. So first, unproctored internet testing. Well, this has been around for quite some time, and it is being used on a very large scale by many organizations. And there is also quite a lot of high quality scientific research available relating to unproctored testing and comparing unproctored testing with proctored on-site testing. And the conclusion is, in general, that there is not that much of a difference between the two conditions. So first of all, if you look at the scores, there is not much difference between proctored and unproctored testing. Also, psychometric properties like reliability, factor structure, item functioning are all quite similar in unproctored internet testing compared to on-site testing, supervised testing. And also the predictive validity of a test is not really impacted if it's administered in an unproctored setting. So in general, we can conclude that the use of unsupervised or unproctored internet testing is safe, and that's probably also why it is being used on such a large scale. A whole different picture emerges if we look at video-mediated assessments. So especially we were looking for studies researching video-mediated simulation exercises and interviews as we use them in an assessment center, but we didn't find any studies relating to the assessment center context. We did find, however, studies about video-mediated assessments in other domains, and these are showing quite promising results. So I will briefly summarize two examples on the next slides. For example, Oostrom and colleagues, they researched a webcam SJT or situational judgment test where participants are presented with different situations and have to react to those work-related situations in front of a webcam. And their reaction is then recorded and rated at a later time by an assessor. And Oostrom and colleagues, they analyzed these ratings and they found really high correlations with job placement success, so a good predictive validity. And also they had a lot of incremental validity beyond job knowledge. And the results were a lot better than you would find for a classical multiple choice SJT. So this shows that it is possible to accurately evaluate job skills via video recorded simulations. Another interesting study comes from the medical domain where video-mediated role plays are being used on a large scale to assess interpersonal competencies, soft skills, and critical thinking in medical doctors or aspiring medical doctors. So these role plays are called multiple mini interviews, and they consist usually of a series of 10 or 20 very short role plays and usually simulating doctor-patient interactions. And these researchers compared scores obtained with MMIs conducted via Skype remotely with MMIs conducted in person, and they found very similar scores. So there was no difference in the scores obtained, and also the inter-rate reliability was even slightly higher for the remote MMIs than for the in-person multiple mini interviews. So this shows that it is also possible to evaluate interpersonal skills, soft skills, via video-mediated role plays. So then what about nonverbal information? Indeed, if we think about a participant's body posture or the way that they enter a room or the way that they take the stage during a presentation, these things are hard to observe in a video meeting. So we could maybe expect that this makes it harder to evaluate competencies like, for example, coping or influencing in a video conference. However, if we look purely at the scientific research in the domain, also as demonstrated on the previous slides, the decrease of verbal information that can be perceived by the assessor actually does not seem to have an influence on the accuracy of the assessments. And what is also found is that a lot of the non-verbal information that in a face-to-face interaction we will process automatically and involuntarily will actually not be that relevant to the competencies of interests. And often it will even act as a distractor, distracting us from focusing on what is really relevant in the assessment center. So from the research, we can conclude that the decrease in nonverbal information does not have any effect on the quality of an assessment. What is true is that video conversations may feel different, both for the assessor and the participant. So I think most of us have had a lot of video meetings since the start of the lockdown, and most of us have experienced this feeling that a video meeting requires more energy than a face-to-face meeting. It feels less comfortable, it feels less pleasant than a face-to-face meeting. And that's also confirmed in research. And the reason, therefore, first of all, is the technical aspects. So in video conferencing, there is also always a slight lag in the transmission of sound and image that makes it harder to take turns talking, and this feels uncomfortable and more energy consuming, especially if you're not used to it. And then second of all, the fact indeed that we perceive less nonverbal information makes it harder to read the other person. We feel less of a connection with the other person. They feel more distant, and this also is experienced by the participant. So that is why it is important in a remote assessment center to pay sufficient attention to the participant experience. So first of all, by attempting to eliminate any technical issues as much as possible beforehand, by practicing with the equipment, testing if everything works well. And then secondly, also by scheduling a brief informal moment between assessor and participant before the actual assessment center starts, for them to get to know each other a little bit and to allow for some kind of a connection, feeling of a connection to be established before the assessment center starts. Okay, that was it from my part. So I'll close with the main takeaways from the literature review. So first of all, remote assessment centers are true assessment centers in the sense that they should meet all the fundamental quality requirements. Second of all, assessment centers are as accurate as in-person assessment centers. This is also confirmed in scientific research in the domain. And thirdly, lastly, the main risk for the practitioner seems to lie in the participant experience. So that's why in a remote assessment center, extra attention should be paid to participants to make sure that they feel that they had the same chance to perform as they would have if they were evaluated on site. Anyone who is interested in a more detailed account of the literature review that we did, should get in touch. An email address is provided at the end of the presentation, and we will share with you then the full-length paper summarizing all the scientific literature in the domain with all the references that we consulted. Okay, this was it from my part. We will now show two client testimonials.